major challenges is on the HR side. Any e-health business cannot only be run by businessmen and technologists. You need a lot of doctors and you need a lot of medical experts to join you as well. And right now, if you look at India as a country, there is a severe shortage of manpower even for hospitals. So for someone to leave a hospital and join us is kind of, it's a very unlikely scenario. So I think HR challenges in healthcare should be the first challenges that need to be resolved for the entire ecosystem to benefit. If you look at the healthcare market in India, if you look at hospitals, most of the hospitals, most of the good doctors are concentrated in the larger cities, which means smaller towns and smaller tier 2 towns in rural areas in India are devoid of good doctors. And I think e-health and technology will play a big role there by enabling access to those patients. So just to give you an example, if someone is coming in to Delhi from, let's say, Mathura to avail a particular surgery, till now he has no way of choosing which hospital he wants to go to. He will actually have to visit Delhi, visit 8 or 9 hospitals and then decide where he wants to get a surgery done. Whereas platforms such as ours can now give him a bird's eye view of all the healthcare facilities available in a city and help him decide 1 or 2 hospitals he wants to visit for his surgery or for his OPD before he actually comes to the city. That will save him a lot of time and that will save him a lot of resources. So that's, I think e-health will enable access in a much more efficient way than is being done today. And in terms of growth, I think this sector is bound to explode because in India, e-health is not a luxury. E-health will be a necessity. Services like telehealth, services like home pickup of tests, etc., will enable a lot of people to access healthcare who are not available close to these healthcare facilities. That was not allowed earlier. I think one of the key areas in healthcare would be analytics going forward. Till right now, IT penetration and technology penetration in Indian healthcare was not that much. So just to give you an example, my parents are doctors, my mother has been a doctor for the last 40 years and we have got like 2 rooms full of files which are not digitized. But if someone can come in and help us digitize those files, that is a wealth of information that can help healthcare service providers and insurers and pharma companies to target the consumer better. So for example, if all the files across the healthcare system in India could be digitized magically, we could very easily detect what regions are prone to what diseases and what are the preventive or curative actions the government or private healthcare service providers can take in those regions to prevent those illnesses from happening. Now, I think technology and IT will enable that, and that will be the biggest selling point of analytics going forward. Healthcare has 2 major problems that need solving for today. One is providing access to people for healthcare, helping people discover the right hospital that they can go to depending on their budget and their location accessibility. And the second is how will healthcare be financed? And LETSMD kind of marries these 2 problems together to produce an integrated solution where a person can come onto our platform, choose the healthcare service provider he wants to go to for his treatment, and also avail financing to facilitate his surgery. The goal of our platform is threefold. It's information, interaction and installments. So what we have done is we are targeting elective surgeries. These are surgeries that are planned and people have time to choose the healthcare service provider they want to go to. So you come onto our platform, we've got detailed videos of the doctors, we've got pictures of the hospital, we've got resumes of the doctors, we've got the starting price for the surgery as well as the inclusions in that price point. So we provide this information to the patient, which helps the patient decide which hospital he wants to go to. Then we also allow the patient to interact with the doctor once before he reaches the hospital through a proprietary voice-based Q&A system. So once he decides the hospitals he wants to go to, we ask him if he would like to avail a loan for his surgery, if the surgery is beyond the reach of his current means. And if he chooses yes, then we ask him to fill out a form and we completely originate the loan online. This is a completely digital finance business. The person doesn't, so no one has to visit the patient, no one goes there to collect documents. It's not a long drawn process. We can originate a loan maximum in 3 days, and the earliest possible time we can originate a loan is in 60 minutes. We partner with hospitals and we originate the loan for the patients. The most of the loans we originate are interest-free loans, where the hospital gives us a subvention fee to convert the patient. So if a patient cannot afford surgery, let's say if his bill is 1,20,000, he can pay 12 installments of 10,000 rupees each, and the hospital gives us a revenue share to to allow the patient to convert into a surgery at their hospital. So if you are recommended a surgery right now, there are two ways you can approach that. One, you will talk to a family member and he will tell you about a hospital that he went to. The high likelihood that he went there for a different surgery, but that's irrelevant feedback. For example, if somebody got a cardiac surgery done at a Fortis and I need to get a knee replacement done, my family members will tell me that's a great hospital, but it might not be great for the specialty I'm going there for. Secondly, the other option is you talk to your family doctor, you talk to your family GP who will tell you 2 or 3 hospitals that he thinks are good for your surgery, right? Now 300 hospitals might be doing that surgery in the city, but your universe becomes 3 or 4 hospitals. So I think eHealth can enable you to look at a wider spectrum of the hospitals available within your city itself before you actually having to go visit each hospital to check how that hospital is. And I think that's what it will enable. It will help people choose better. It will help you to get a feel for the doctor, for example, before you enter the hospital. And that I think is very important before you actually get a surgery done. The building comes second, the infrastructure comes second. A very important part is how the doctor walks and talks and whether you are comfortable with the doctor. I think that's what technology will enable, even for people who are living within urban areas. Telehealth, there has been a lot of innovation on the telehealth side where people are developing technologies not just for the consultation part, but also to transmit and transfer your scans, diagnostic reports, etc., which helps in a more accurate diagnosis of the patient. Secondly, I think even if you look at on the technology side of things, more and more hospitals are now implementing technology within the hospital itself. So there are HMIs in place which helps a hospital better track how the patient is moving, how his health is, and helps a hospital better track the data that they are accumulating. And once we accumulate sizable enough data, then that data can actually be put to use to better social health in general. Like I was telling you, it will be very important going forward to identify what areas in the country are prone to what diseases, so that those hospitals can come up in those regions rather than general hospitals that treat everything. The government has drafted very ambitious plans for the healthcare sector, and opening more AIMS, providing more access to facilities, and I'm talking about both regional as well as central government. If you look at Aam Aadmi Party's Mohalla clinics, they have been a spectacular success in reducing the workload of super specialty hospitals and taking care of the primary care needs at a local level itself. So I think such innovations will really help India in the long run. One of the things that the government should definitely focus on is creating more manpower. As I told you, the challenge, you can open a lot of hospitals, but if you can't provide them with the right quality of doctors and nurses, those hospitals will not be able to deliver results. So I think the focus should be on improving the quality of teaching being imparted currently, and then the focus should move to creating more infrastructure to create more teachers and doctors and paramedical staff.